Hello, my name is Carlos Jimenez. I'm a senior manager with Whipley's Healthcare Practice. Thank you for your interest in the Rural Health Clinic program. You have accessed Part 3 of the 5-part session entitled Rural Health Clinic 101. The Rural Health Clinic 101 session is designed for individuals who may not be familiar with the Rural Health Clinic or RHC program. For additional information about the RHC program, please access Parts 1, 2, 4, and 5 of Rural Health Clinic 101, as well as other focused educational RHC webinars sponsored by the Wisconsin Office of Rural Health. This is Rural Health Clinic 101, Part 3, Rural Health Clinic Regulations Compliance. As we think about rural health clinic regulations and compliance, there are three major areas that we will focus on as overview, not in any great level of detail. The first are the overarching laws, regulations and guidance, and policies and interpretations. Insofar as the law is concerned, RHCs are governed under the Social Security Act, Title 18, Section 1861, AA. In addition, there are requirements in Title 42, Chapter 4, Subchapter B, Part 405. We won't go into it. You can see it there. And the conditions for certification are listed in 42 CFR, that's the Code of Federal Regulations, Section 491. So that is where you would go. I provide you with some links later on to go and look at these if you so choose. Insofar as regulations and guidance, we essentially have three sets of materials. We have CMS manuals, we have transmittals that amend the manuals, and we have the MLN or Medicare Learning Network Matters. That is a periodical that is published by the federal government that you may subscribe to. Insofar as policies and interpretations, we're really talking here about what parties external to the RHC are looking for. Those would be found in the State Operations Manual, Appendix G, and we will look at all of these as we proceed. What you have before you there is Part 405 of Title 42, and these define many aspects of RHC operations. So you see them there, the basis, scope, and definitions, requirements, how to become part of the program and enroll in Medicare, the scope of benefits, and again, these are in general terms, and different types of services. Further here, payment for the service, what constitutes a visit. So essentially all of the general rules that you would be looking for regarding RHC status would appear in Title 42, Part 405 as shown here, and I'll give you a link to that a little bit later in the webinar. We have RHC conditions for certification. These are, in addition to the laws, these are the most critical aspects of the RHC operation and organization that you need to focus on. And as we go down, you see, first of all, compliance with federal, state, and local laws. The citation in 42 CFR Section 491 is listed for each of those. Where is the clinic located? There are requirements for physical plant and environment. There are certain organizational issues and structures that CMS wants to see. We have staffing and staff responsibilities, provision of services, patient health records, a program evaluation, which is the system by which you evaluate the effectiveness of your program. And the last one, which is the newest, is emergency preparedness. And this is a fairly significant issue that has only recently come out. Again, I give you the citation there so that you can look at it, but because it is a recent condition that was added, we are finding that a number of RHCs have not addressed this or perhaps are not in compliance. So those are the 9 conditions for certification that you would one would need to be familiar with. Federal regulations and guidance. So we'll start with these one by one. The first is allowable cost and the treatment of cost. So for a rural health clinic, all rural health clinics are governed overall by the Medicare regulations. So those relating to allowable costs, the treatment of cost in various reports are listed in the Provider Reimbursement Manual, and that is CMS Publication 15.1. On your screen, you see a link to a web-based point of access for that particular publication. We have covered services, and those are found in what is called the Medicare Benefit Policy Manual, CMS Publication 100-02, Chapter 13. This defines in greater detail the nature and type of services that are covered as patient care services in an RHC setting. So this is a very, very important component of regulations. The third is billing. And billing, we look to the Medicare Claims Processing Manual. That's CMS Publication 100-04, Chapter 9. And while one may be compliant in terms of the covered services and all of the other aspects, billing is a key component. It is the essential component to being paid for the services that the clinic is rendering. So understanding and being in compliance with the Medicare Claims Processing Manual with respect to RHCs is a very, very critical aspect of operations. As I had mentioned at the outset, we have CMS transmittals, and these are informative, amending types of documents that are issued periodically to explain new or revised regulations and correspondingly amend the various CMS publications. So for example, if there was some change to covered services or a definition or a description intended for the Medicare Benefit Policy Manual, there would be a CMS transmittal specifically referring the publication that you see there above in Chapter 13. And these are issued as often as changes, amendments, new regulations come through. The Medicare Learning Network, which I also mentioned previously, that is free educational materials for healthcare professionals on CMS programs, policies, and initiatives. The best way to access this kind of information, particularly if you are in either preparing reports on behalf of an RHC, involved in covered services, or billing, is to get a subscription. The website link is listed there on your screen. You can certainly go to that website and look at it periodically, though the recommended method is to go to the website and sign up for a subscription. Comes in email. It comes as often as they are issued and can be very helpful. The email subscription also has hyperlinks that you can click on to go get specific information referenced in the MLN newsletter. Insofar as policies and interpretations, I had listed the State Operations Manual, that is CMS Publication 100-07, and Appendix G is the guidance for surveyors of RHCs. And we won't go into it in any depth because this will come up in a subsequent session. But when a rural health clinic seeks certification from Medicare, there are, of course, numerous documents that must be submitted. But upon acceptance of your submission, a site survey would be scheduled. And this publication here, the State Operations Manual Appendix G, is the guidelines that will be used by surveyors. So if you are part of a provider where you are just getting started, it is very informative to go to this appendix and look at the specific guidelines that the site surveyors will be utilizing when they come to your facility. And again, this is a good tool for prior to the certification site survey. Common compliance issues. These have to do with issues that are identified in the site surveys. There is a CMS website. I've given you the citation there. It's called the QCOR website, Quality Certification and Oversight Reports. And there is a plethora of information there, but specifically I wanted just to focus in thinking about compliance on some of the common issues. So this is an excerpt from a QCOR Citation Frequency Report for 2018, and this is the type of data that is available to anyone publicly online. It shows that there are presently 4,407 active RHC providers, and in this particular period, there were 279 surveys done. Now again, remember that those are generally done at the inception of a clinic, but there may be reasons why a site survey is conducted for potential deficiencies, issues, things of this nature. But during the year, there were 279. And what you are seeing in the table there are the three most common citations for 2018 that have been recorded. There's a tag number, we'll reference that in a moment. The description is maintenance. Again, that is somewhat cryptic. We'll go into that. So the number of citations under this tag number 0023 were 136. The number of providers cited was 3.1. That is not particularly indicative because it's based on the total number of providers. I suppose if they saw that a number of providers had this, that would be meaningful, but the more critical number is to the far right, the percentage of surveys cited. So what this tells us is in 2018, 48.7% of those surveyed had a deficiency in this maintenance code 0023. So that's a fairly significant number. And if you are in the process of preparing for a survey, it certainly bears some degree of attention so that you'll see what this was. The second most is code 0022, where the deficiency rate of those surveyed was 24.4, and the third 0070 is for record system, where approximately, well, 20.4% of those surveyed were cited for this. So those are the top three. Within the table that you can actually download, there were numbers of other deficiencies cited, but they were not materially significant. They ranged from 17% down to tenths of percent. But these are the three most common. So let's take a look at this in a bit more depth. So these are the full tag number descriptions. J0023 is drugs and biologicals are appropriately stored. Now, in this webinar, it's not our intent to tell you what is appropriate storage of drugs and biologicals, but it is important to know that almost half of those surveyed were cited for, if you will, inappropriately storing drugs and biologicals. This may have to do with ready access. Is it a locked cabinet or a locked closet, something of that nature? Are they properly labeled? Is there a system in place for drugs or biologicals that are expiring? That's the types of things that would be noted here in a citation or deficiency citation. So that is the most common and definitely warrants some attention if you are in the place where you are anticipating a site survey. The second most common, J0022, all essential mechanical, electrical, and patient care equipment is maintained in safe operating condition. Now, they don't walk in and turn on every machine or device during the course of a survey. What this means is there documentation, and it must be tangible documentation, that all equipment that requires maintenance has been maintained, is in good working condition. And so really this is more generally a record-keeping type of function, and during the survey, they will look at that. If you are large enough to have a person who is responsible for your plant operations, that individual will be critical. But if not, it doesn't excuse the need to maintain all of the appropriate records. And as you see from the table above, that was about 24% of all those surveyed were deficient in this. And it generally, again, is a function of documentation. J0070 is pervasive. The description is, for each patient receiving healthcare services, the clinic maintains a record that includes, as applicable. So I will go through those because I want you to hear them and see them. Identification and social data, evidence of consent forms, pertinent medical history, assessment of the health status and healthcare needs of the patient, and a brief summary of the episode, disposition, and instructions to the patient. So that, though contained in a very small paragraph, involves a significant amount of information, often culled from different sources, that must be made available, readily available to a surveyor. And that means not pulled together after a process of reconciling and looking, but actually generally in one location. We have the second point, reports of physical examinations, diagnostic and laboratory test results, and consultative findings. Now, most of this today is done electronically, but that doesn't excuse, nor does it sometimes make it easier to compile and have available upon request this type of information for a specific patient or patients. The third is all physicians' orders, reports of treatments and medications, and other pertinent information necessary to monitor the patient's progress. The fourth is signatures of the physician or other healthcare professional assenting to what is in the various records, treatment plans, diagnoses, and things of that nature. So again, if you remember the table, that was approximately 20% of those surveyed had some deficiency in that area. Now, typical for these types of surveys, if one is cited for a deficiency, there would be a period of time given to come up with a plan of correction, and that plan of correction would have to be specific as to how the clinic intends to achieve full compliance in whatever area citation that that has been identified. So that's the citation, and very quickly that is what we have for today. I want to thank you again for your interest in the Rural Health Clinic program. You've just participated in part 3 of the 5-part session entitled Rural Health Clinic 101. Again, for additional information about the RHC program, please access parts 1, 2, 4, and 5 of Rural Health Clinic 101, as well as other focused RHC webinars sponsored by the Wisconsin Office of Rural Health.